Okay, do we have a quorum?
Yes, Mr. Chair, we do have a quorum.
Okay, let's all stand and for the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Jacob, you want to make
So
an
at this
introduction?
time, we will move to the consent agenda. The
Gonna introduce
consent
her
agenda consists of items number 4 through 15. Are there any items that any of the board members would like to pull for additional discussion?
Move approval.
Okay, I have a motion to approve the consent. May I have a second?
Second.
Ms. Olguin?
Yes.
Mr. Volk?
Yes.
Mr. DeGroat?
Yes.
Ms. Martinez?
Yes.
Thank you. The consent agenda is approved. We now move on to our regular agenda. Agenda item number 16, receive and take appropriate action on the CEO report for the El Paso County Hospital District doing business as University Medical Center of El Paso. Mr. R. Jacob Cintron, President and CEO.
Thank you. I think before we begin, I'd like to introduce again Ms. Estela Casas, if she'll stand for us, our new Executive Director for our foundation. I understand Kay Fox is here thanking you too for coming over here. We're really glad she's hit the ground running. I'm a little worried. My wife asked me, how's she doing? I said, I think I hired my mother because she's already given me a list of things to do. And my wife said, well, that's a good thing. And so we're really proud of her being on board. And, she's got a lot of great plans. She's really an inspiration. Her own values and mission now are aligned for us to be able to benefit those we serve. So we're really grateful that she's here with us heading up our foundations, both at UMC and El Paso Children. So welcome. We'll go ahead and get started. First of all, we had on February 4th, last Tuesday, our ribbon cutting for our Northeast freestanding ED. And we're really proud of this. It's got 4-bed fast track, 6 emergency treatment rooms, and 1 trauma room. It's open 24/7. It provides CT services as well as lab. It provides access 24/7 in the northeast part of town, so we're really proud of that. We had our ribbon cutting this morning at the Joe Battle site. Doesn't look like this photo. It would have to have a lot of rain and some clouds. But I will tell you, both days were also cold. But it's also attached to our Joe Battle Clinic, and it too is open 24/7. Shares the imaging equipment such as the 64-slice CT, and is able to accept EMS traffic at both sites to provide, again, that 24/7. And it will also provide an urgent care service as well, so that if the patient is really not a high acuity to require ER services, that we'll be able to see him as an urgent care patient, which would certainly be less expensive for those in the communities we serve. If you haven't seen them, I would certainly invite you to go look at them. Before we get too busy, you can always call us. We'll be glad to arrange a tour. We also had the Health Start 2020. We had this with about 500 registered runners, which is the highest amount we've ever had. And this was a weekend ago. And I will tell you that we had the El Paso Children's did a dash with the kids, and it was amazing. You'd see them running, and there was one where I guess trying to figure out what it was, but McGruff, the dog, actually had to carry one of the young kids over the finish line, but it was really nice. It started off a little cool, but it really warmed up to be a real nice day. So UMC, with its partner El Paso Children's, was able to really enjoy this event, along with our community partners, the El Paso Police Department, Elite Ambulance, and many families who came out to enjoy the event. It included healthy eating booths as well, and nutrition booths and exercise booths, and really was a nice time for families on the west side to get together. Additionally, we had the ever popular Dr. Alan Tyrock, who is our trauma medical director for the Sherligate Trauma Center, as well as, the chief of staff for UMC. He spoke at Commissioner Stout's program. It's an interview that Commissioner Stout provided for a social media program called Sunday Conversation. And he usually interviews someone each month, delves into greater detail about life in El Paso County, and really talked about the mass shooting and our first responders and some of the challenges trauma centers face. And quite frankly, Dr. Tyrock has been our voice in talking with our state Senate, as well as our state representatives related to what we went through and the kinds of things that would help us be able to address some of the challenges when you have these mass shooting events occur. So we're really thankful to Dr. Tyrock and his commitment and really his compassion in making sure that we were ready. And I was really proud of how, in fact, on August 3rd, he had this department fully ready to handle not only the number of patients we got, but we could have easily handled another double the amount of patients we got. And that's a credit to Dr. Tyrock as the brainchild in getting this trauma program to the level that it is. So thank you, Dr. Tyrock. We also, as I said, we've got Estela Casas working with us now. We look forward to the upcoming gala for the El Paso Children's Hospital. We had this morning Western Technical Institute donate $250,000 to El Paso Children's as a naming right for the rehab gymnasium. And so really proud of the efforts that our foundation is going through and in raising awareness of the fine work that we do here. I think we got a chance to meet a young preemie who was much healthier. She was really active and really cute, but it tells you the lives that are touched with the kinds of things we do together. I believe our pediatric neurosurgeon, Dr. David Jimenez, was also on the cover of City Magazine, Cindy. So, really proud of the fine efforts we're doing in improving the healthcare for our community. That concludes my report. If there's any questions, I'll be glad to answer them. If not, thank you.
May we have a motion to accept the CEO report?
So moved.
May I have a second?
I second.
Ms. Olguin?
Yes.
Mr. Volk?
Yes.
Mr. DeGroat?
Yes.
Ms. Martinez?
Yes.
Thank you. The CEO report is accepted. We now move on to agenda item number 17. Receive and take appropriate action on the following quarterly reports. Our first will be on behalf of the medical staff, Dr. Alan Tyrock, Chief of Staff.
Good afternoon. Thanks for having me over here. Sorry I missed it last month. I think I was sick or something, and then we had a retreat the next week. So let me start with our quarterly reports. This is actually covering November, December, January. We had our Cancer Committee quarterly report. We talked about the infusion center that's expanding its hours once they get more nurses recruited and hired. I think they've made some progress there. There were two goals that the committee wanted to work on through the year. The first was deploying stents for palliation and bridging therapy for pancreatic cancer. They were very successful with increasing the number of stents that were placed. We are growing with pancreatic surgery here with the Whipple procedure, which is what we call the ultimate surgical procedure for cancer. So we have 3 surgeons doing that. The second was improving or decreasing the wait time from initial diagnosis to chemotherapy for colorectal cancer. Not quite there with the goal, but they're getting there. We had our annual evaluation of environmental care, which is really the disaster committee report. I think we also presented that, or it was presented at the PAC last week. The quarterly ethics committee update was given. There were 7 ethics consults in the calendar year 2019. That continues to increase. That's led by Dr. Cruz Flores, who I think is actually still in Antarctica right now, trying to stay warm. We had the the quarterly El Paso County Medical Society update and the TMF update, which is Texas Medical Association. We talked about the HIE, which is Health Information Exchange, which is starting to really come on board. I think all the hospitals in the region are up on it right now, except for HCA. We had an update on the VA expansion, the south side, the west side of El Paso. Flu cases, as you know, continue to rise. We're in the top of the flu season right now, January. has been very rough. We also were told that the vaping illness, which we know that's becoming an epidemic, is now a reportable condition for the state, just due to how much that's impacting, especially young people. The resident health staff report was given. The main thing is they're happy. We want to keep them happy for many reasons. So we have very happy residents here and fellows. They do want to get more involved in medical staff committees, and we're implementing that. They did talk about they would like to be able to use the UMC gym, and I know they're working with Maria to see what could be done with that. That was the quarterly reports. Some other items, we had our monthly MSPI, the bylaws, credentials, and pharmacy and therapeutics report. Some of the highlights, we also discussed Leapfrog, which UMC got a grade of B last time, and Alice actually did a very good job telling us how the scoring methodology, what it entails. It's extremely complex, and it takes a while to raise your grade or drop your grade, I guess, too. Hopefully we'll be an A next time. We discussed the TB testing policy, and we had an update today at MSPI about that also, where not just the associates, but the medical staff and residents don't need to be undergoing this annual TB testing, so that's a good thing. That's a change by the CDC, and we're implementing that here as well as at Texas Tech, and hopefully at Children's too. We reviewed the DNR consent form process, and that's being implemented, and we're still educating the medical staff and residents on that. It's a little confusing, but we're getting there. We also updated, that was led by Dr. Hendricks, about the physical exam component of our H&Ps. So we're doing some more wordsmithing on that, and it's gotten brought back to the bylaws committee. Got our monthly parking update from Pat. And we know the gates are up and down now, and I think that's actually helped somewhat. It's easier to park now to go on the top floor like I used to. We review some policies that are going to the medical staff for a vote, and then I'll be presenting that at the March 10th Board of Managers for approval. Informational, Dr. Mark Orlandi has been appointed the interim anesthesia chair. I think that's been in effect about 3 weeks now. Dr. Pablo Mujan retired from that position. He had been there for several years. And one thing that I need a vote for, and I'm not sure, do I do it now or later, the vote for Dr. Figueroa? Is that on the agenda later?
Yes, it was on.
Actually,
it was
for
approved as
items,
part
yeah.
of the consent agenda.
So yes, that's true. So Dr. Figueroa has been moved back to being the medical director of respiratory care and critical care pulmonary, replacing Dr. Hernando Garcia, who was filling in that role, and you just approved that by consent. That's my report. Any questions for me? Thank you.
Thank you, Dr. Tyrod. At this time, we will receive a quarterly report on behalf of the Texas Tech University of Health Sciences Center at El Paso. Dr. Richard Lang, President.
I was going to do your report for you.
Go ahead.
No, I'm just kidding.
You'll try.
They said I was.
Just to be sure, I just want to highlight one thing. On February 28th, we'll have the first gala we've ever had, and that will celebrate the 10-year anniversary of the Paul L. Foster School of Medicine. In 2009, in July, there were 40 inaugural students that joined the medical school class. Since then, we have 520 graduates that are physicians and/or residents in training around the state. Just to put it in perspective, when the medical school started, there was a 75% shortage of physicians in this area, and now it's about a 50% shortage. And I'm happy to say that of the 1,251 active physicians in El Paso, 350 of them did their residencies here at UMC. 76 graduated from medical school in Lubbock, and 12 have graduated from medical school here. So about a third of all the physicians in this area have ties to us. I say us, collectively together. We have 105 students now. We're going to 150 students to help meet that need here in the community. As you all know, it's not only meeting the need by having physicians here, but having the breadth and the depth of services here. And so we're very pleased. Many of you will be at the gala. If you don't have a seat or a ticket, I'm sorry, it's sold out already. All that money, by the way, will go to fund scholarships for our students. Not a single penny will be used for any other purpose. And our goal was to raise $250,000. Thanks to the community, we've raised at least $350,000 last I saw, and it's still going up. So I want to thank UMC for partnering with us for the last 10 years, and look forward to what the next 10 years do together. Thank you.
Thank you, Dr. Lang.
Thank you, Dr. Lang. At this time, may we have a motion to accept both quarterly reports?
So moved.
Second.
Ms. Olguin?
Yes.
Mr. Volk?
Yes.
Mr. DeGroat?
Yes.
Ms. Martinez?
Yes.
Thank you. The medical staff and the Texas Tech University quarterly reports have been accepted. We now move on to agenda number 18. Receive and take appropriate action on an annual report from Emergence Health Network. Ms. Kristen Doherty, CEO, Emergence Health Network.
Good afternoon. I apologize, I jumped the gun on Dr. Lang. Before I get started, I wanted to recognize some folks that I have with me today. I'm very honored to have my newly elected board chair with me. Ms. Joyce Wilson is here today, and I'm really happy to have her here supporting us. And then also, we're excited to have our new board member that you recently appointed, Ms. Cindy Stout. So I definitely have two board members rooting for me as we go through this. And then I have some staff with me today. Renee Hurtado and Renee Navarro are here, so if you have hard questions, they will be able to answer that. And then for those of you who don't know, we have a interlocal with the county attorney's office, and we used to have Omar Villa until he was kindly asked to move up to the big kid table here. So we do have Michael Wyatt as our general counsel, but we also have Anthony here with us, and so he's recently joined our team, and he came along also to answer any hard questions. So what we do, we like to come in and give you guys, give the board an update on our annual report. But this year we're doing things a little different. We've never given you guys any takeaways. So what you have in front of you is a nice packet of takeaways. We are going to go through the annual report, which what we've done this year is we've softened it a little bit. We feel that the 2019 was a year of hope and healing for our community. And so we did do our annual report around that theme. And so first what I'll do is I want to go through the report, just some highlights of the report. We have continued with the approach of an electronic version. So we will not be sending out a booklet or anything like that. We do send out a postcard with a link. So many of you will be receiving that link to be able to click on to the actual report and see it live. Again, I will give you some highlights of that today. The main theme of the report really is our response to 8-3, as has been highlighted today. EHN was on the ground that day. We have our CIT team, which I'll go into more detail shortly, that was that responded to that 911 call. What that is we have therapists that are in police cars. We have partnered with the El Paso Police Department. So we had 2 therapists in the parking lot that day that responded to that call. Along with that, we were here alongside your team. We had Renee Hurtado was in your command center. We had staff in the emergency room working with families. We were, myself, along with many of our other administrators, were at the command center on Threadgill, coordinating efforts. We were at the reunification center. We were at Del Sol. We were wherever we needed to be. We're at 5 Points. One of the things I need to let you know first, thank you for your trust in us and the partnership. But I have had the opportunity to talk to my partners in this state that responded to the Santa Fe shooting, that also responded to the Sutherland Springs shooting. And their communities, behavioral health was an afterthought. It was, days later when they thought, oh, we probably should bring in the mental health authority and bring in the behavioral health partners to look at what's going on. I can tell you our community, behavioral health was an immediate thought. We were one of the first calls that were made, not only to support what was happening in the emergency rooms and what was happening at the reunification center, but what was happening with our first responders. I had staff talking to the 911 calls that took the multiple calls that day. We were talking to them that afternoon. I myself briefed with about 80 firefighters that were in that parking lot that afternoon. So I can tell you our community has behavioral health at the, right at the forefront of what we do. So that's something we need to really be proud of. And we continue to be, we continue to look at behavioral health and the mental health of our first responders, our clinicians, our entire community is as a priority. So that's something that we're very proud of. Sorry, I went too fast. So minutes, again, minutes after the shooting, we were involved. Within a few days after the incident, we had a community resource center stood up. And if you look inside your packet, there is a brochure with regards to that center, where it's at. Anybody that needs any sort of support from the incident can just walk in to that center. I know Miss Martinez called me one day and she needed something. I gave her that information, and that individual can just walk in and get whatever they need with regard to that service, no questions asked. Crisis services is available 24 hours a day, 7 days a week. We did have some outreach opportunities. We stood up support groups in a matter of minutes. We can send the presentation out, but that resource center, we can send people to you, but they can also walk in. We had partnerships with schools, churches, law enforcement. We tried our best to put access points wherever those needed to be when they needed them. We're continuing to do that as well. For instance, this week, we partnered with the Jewish Federation here locally. They sponsored an event. We brought folks in from Israel who deal with crisis every single day. We have them, they're doing crisis training here. 3 days for therapists, 1 day for the faith-based community, and on Friday they're going to be doing training for our first responders. Really how to respond to incidents that we dealt with, and then how to take care of yourself. So we're continuing 6 months later to still provide support to our community. So what I want to do next, part of our VOCA, our Victim of Crimes Act monies that we receive from the governor's office, I hope you guys were able to see it over the holidays. We pushed out a large campaign on social media, on television, radio. We pushed out a Helping is Healing campaign. We didn't put our logo on anything. It did have our crisis line. We really wanted people to see people like themselves, we wanted it to really be owned by El Paso, to really understand it's okay to get help. It's okay to talk to somebody. So the next slide up, there's going to be a couple of quick PSAs that we pushed out, and we wanted everybody in El Paso to know that there's someone there just like them that may need help. And so hopefully you were able to see some of this. I think we... Okay.
Strong means healing.
Strong means helping. Strong means getting help.
Strong means reaching out.
Is it now okay?
Strong means healing.
Strong means helping.
Strong means getting help.
Strong means reaching out.
So we really pushed that out as far and wide as we could. We had a lot of partners with our local television stations. Again, those are on social media, and we really want folks to get help. We've had we're collecting data, and that has had a huge impact in our community. So we'll continue to do that. It's going to be an 18-month campaign. Next, what we're really proud of is some highlights of 2019. Again, our CIT partnership. That's a partnership we have with the city of El Paso and the El Paso Police Department. Again, where we have therapists in police cars, where we're responding to any call with a mental health involvement, domestic violence. CIT, we've had about 4,000 dispatch calls, about 1,200 observed calls, 3,000 adults checked on, and about 200 adolescents checked on this year. The anniversary of that program being launched will be Valentine's Day. It went live Valentine's Day last year, so we're very proud of that. If you look in your packet, there's a little pamphlet that says Mental Health Learning Library. That's a partnership with the Paso del Norte Health Foundation. What that is that's a library of trainings that we can do for free of charge that we do throughout the community. There's cards inside there, so any organization, any company, anybody that would like training, we obviously offer mental health first aid that we've educated the community about. That's a 8-hour training. A lot of folks can't they don't have time for 8 hours. These trainings are smaller doses of training, so we were really excited and we did a big campaign to push that out this year. The next thing you'll see is the National Council for Behavioral Health is a nationwide organization that has about 4,000 members. They chose El Paso to come and learn about what we're doing in El Paso to provide mental health services and our partnerships. Dr. Lang actually sat on a panel with me to talk to a congregation that came in from all over the country, and they were so impressed with what we're doing here on the border with the partnership that we have with Tech, with UMC, also they were very impressed with what we're doing in our jail. So we were really proud to highlight the work that's being done here in El Paso. UTEP, we've been working very closely this year with UTEP to strengthen their workforce. One of the things we're doing is we actually have a couple of our executives teaching classes to the rehab sciences at UTEP, to where the last semester of that course we are teaching our QMHP, our Qualified Mental Health Professional classes, to where they're graduating with that certification and can come directly to work for us. So it's really a pipeline to be able to keep that workforce, those folks wanting to come to work for us, but then when they graduate, they're already ready to be employable by us. And there's some other, we're working with the Dean of Health Sciences to expand that to where we have more touch points, and then also trying to put the mental health first aid curriculum in the Department of Education to where our teachers are getting exposed to the mental health first aid. We really don't talk a lot about the IDD population, and we have continuums of care for mental health and a lot of things. So we worked really hard to develop an IDD continuum. It's very robust, so if anybody would like to see it, we'd be happy to share it with you. It's about 3 pages long. So there's a lot that goes on from birth. It's like cradle to grave with IDDs, so we wanted to start spending more time on that, because every legislative session there's rate cuts that take away from individuals with IDDs, so we want to put more emphasis on preserving those services. And then our multi-systemic therapy program, it's a program that we work with juveniles that are at risk for out-of-home placement. So we did publish a paper, it's locally, that shows the impact of the services that we've provided here to those juveniles that are involved with juvenile probation, and they are at risk for out-of-home placement. And there is a copy of that paper in your packet that shows the impact that program has had here in El Paso. So again, we wanted to share that with you so you can see that the services that have been provided here, and that program was funded partially by the 1115 waiver and also by the Juvenile Probation Department. So you can see that those dollars locally and what the impact has had. Next, we always try to share with you our revenues and where those come from. So again, our total operating budget for 2019 was $52 million, and the breakdown there goes, so you can see where it comes from. Hospital district, that's a $300,000, and what that is made up of is our partnership that we have our clinicians in the clinics, and they're supporting your primary care operation through the behavioral health screenings and the supports that we provide there. The county contribution is the jail, is mainly made up of our services that we're providing in the jail. And then we have our federal monies as well as our state money. And then the other is primarily made up of our 1115, our private insurance, and some other small revenues that come in. The next slide is going to show you our expenditures, by division. So we have our different operating division, and if you look at that other kind of catches people's eye, really that's our support department. So that's going to be your HR, your IT, administration. That's a lot of our support departments that makes up that other column. This is going to be this is it's a lot of small numbers, but you can get on the website and look at it. But this is really who we serve under the demographics. So it shows by gender, ethnicity, and things like that, if you wanted to ever understand who EHN serves. Something else we learned going back to the 8-3 event is when we were responding, and a lot of the times we were talking to people, we kept saying the LMHA, LMHA. And when we talked to folks, they looked at us like, what does that mean? Who is that? What is that? And then, people had this glossed over look. And so when we did our after action report and we did after action exercises, one of the things we realized is the community as a whole did not know what an LMHA was. And we kept using that acronym. And so what we did done with the help of our legal department, and they did a great job, and that paper is also in your packet, is we put together a white paper to help people understand what LMHA means. It's the Local Mental Health Authority. What is the role and responsibility of the Local Mental Health Authority in your community? And so we hope you take the time to look at that. Being a sponsoring entity, you're the reason we exist. So really help understanding that the Local Mental Health Authority is here to plan and coordinate, and we're here to help resource allocation and bring more resources in and bring people together to make sure needs are met. And then there's a whole nother piece of that we have a responsibility during a disaster. So we made sure that that's spelled out as also in that paper. So we realized we have some work to do from an education perspective. And so I spent some time with the residents in the psychiatry department at Texas Tech, helping them understand what the Local Mental Health Authority is and what we do. Something else is we rewrote the behavioral health disaster chapter in the city's disaster plan. And we found that's not something that's common in a community, that the mental health authority being responsible in that. So that's something else I think El Paso needs to be proud of, is that you include your mental health authority in that planning. But there's the statutes are listed in that paper, and we really wanted to make sure that we're taking that far and wide and helping people understand what the LMHA is, what those 4 letters really stand for, and then what our roles and responsibilities are in general and in a disaster. So again, there's just some high-level statements outside that paper, but if you have some time, take a look at it and really understand what UMC's responsibility is when you create your local mental health authority. This is another small slide, but you have a copy of it in your packet. One of the things we've done over the past couple of years, I joke and I tell my staff we're data geeks. We really like data. And so what we've done through our strategic planning process over the past couple of years is we've created a balanced scorecard. And we wanted to share that with you as a sponsoring entity. So this actual snapshot of what you're going to see is December of 2019. So what we do as a balanced scorecard is what this is a snapshot of the health of the organization at a given point. So we chose these quadrants through work with our board, and you have 4 areas that we look at. Obviously, fiscal is very important. And so this is going to be based off those metrics. And if you look in your packet, there's a legend behind the balanced scorecard that's going to give you the definitions of each one of those metrics. It's going to tell you what they mean. And then we have a stoplight report saying where we are with regards to where we want to be within a range. And then we have client care metrics that we want to make sure we're meeting. Organizational learning, that's tracking where our employees are. What are they doing? Are they retaining information that we're sending to them? And then the last quadrant there is going to be safety. We're really looking at environmental safety and making sure things are our facilities are safe and what we're doing. So we wanted to share that with you as a sponsoring entity. Again, this is a snapshot. This is a moment in time. It changes every month. And we're constantly tracking that and making sure that the organization is progressing. And then you have some trend lines as well. So if you look at those metrics, if you flip the page, you'll be able to know from a definition perspective which each one of those mean. And we're really proud of where we were 8 years ago when I took over and where we are today as far as an organizational health perspective. And we're willing to answer questions on some of the red dots, if you are, red areas. Those are areas that we focus on. If we trend in a red area for more than 2 months, 3 months, I've got compliance really focusing in and honing in on those to see why we're in the red for more than 2 or 3 months. And then we're able to put in some quality controls to make sure that those areas are addressed. But this is something the board looks at, and this is something that we track on a monthly basis, and these are areas we feel are quite important. And really, the last thing you're going to have in your packet that's not part of this slideshow is something that has been, again, we've been talking about for about 2 years now, is there's a certification that the state of Texas has asked local mental health authorities to pursue, and it's called CCBHC, Certified Community Behavioral Health Clinics. There's a little white paper. We've given you plenty of reading if you can't sleep at night. To look at, and we are very excited to say that we are days away from being certified. We will be the 7th center in Texas to be certified. And what's happening in about probably around September of 2021, the financing model on how community mental health centers will be paid is going to change. Fee-for-service is really going to shift. They're going to shift away from fee-for-service, and so the way individuals that are in the more acute side of things, the severe and persistent mentally ill, will no longer fall in a fee-for-service model. It'll be a capitated rate. It'll be more of a prospective payment per member per month, but you have to be certified to receive that rate. So we will be certified hopefully in the next couple of days, weeks. They keep telling us that, and we're moments away. The state has everything. They keep telling us we're there, and so that paper will give you a high-level understanding of what that certification means. It will change how services are going to be delivered. I think it'll give us some flexibility to be able to address people's needs rather than worrying about a code to bill. And it'll allow us to really provide the level of service those individuals who are at risk need. So we're excited about that, and as that progresses, hopefully we can spend some more time educating folks on that, and the folks that are high utilizers of psychiatric beds, high utilizers of emergency services, we can do more for and really get them what they need and the time they need it. So we're excited about that. And I can answer questions and hopefully give anybody, clarify anything that I covered.
Any questions?
If there are no questions, may we have a motion to accept the EHN annual report?
So moved.
May I have a second?
Second.
Ms. Olguin?
Yes.
Mr. Volk?
Yes.
Mr. DeGroat?
Yes.
Ms. Martinez?
Yes.
Thank you. The EHN annual report is accepted. We now move on to agenda item number 19, review and adopt a resolution in support of the University Medical Center of El Paso Level 1 Comprehensive Trauma Facility redesignation. Dr. Alan Tyrock, Chief of Staff. Ms. Sandra Gonzalez, Trauma Program Director.
Good afternoon, Chairman Grote and board members. I come today to request your continued support of our Level 1 Trauma Center. UMC was first verified as a Level 1 Trauma Center by the American College of Surgeons back in 2001. And since 2008, every 3 years, we've had re-verifications with 0 deficiencies. We know that this definitely could not have been accomplished without the board's support and our leadership. So the letter before you reaffirms your support, and it will be shared with the American College of Surgeons surveyors during our June 2020 visit. I'll stop there to entertain any questions you may have.
This is just a letter that reaffirms the board's commitment to maintaining the Level 1 Trauma Center and its impact, and recognizes Dr. Tyrock and the work he's doing. And the American College of Surgeons requires this as evidence of support by the board for its recertification.
We do another letter as medical staff too. It's required by the COT, Committee of Trauma. Thank you, though.
So we need, excuse me, we need a motion to approve the resolution that you have in your packet.
Move approval.
I second.
Ms. Olguin?
Yes.
Mr. Volk?
Yes.
Mr. DeGroat?
Yes.
Ms. Martinez?
Yes.
Thank you. The resolution for the Trauma 1 redesignation is adopted. We now move on to Agenda Item 20, discuss and take appropriate action on management and lease agreements for the Medical Nursing Home Quality Incentive Payment Program, QUIP. Mr. Michael Nunez, Chief Financial Officer.
And also with me will be Omar Villa, our Chief Legal Officer. This is more of an update of an item that was brought to the last month's Board of Managers meeting regarding the Medicaid Quality Incentive Payment Program. This is a Medicaid supplemental program that the hospital district is looking into getting into this year. Some of our other large public hospitals in Texas, such as Parkland and Dallas and University Health in San Antonio, are also participants in this program. Just as a background on this, this is for nursing home facility partnerships within a 150-mile radius of the hospital district. There are approximately 20 of them. 11 of them are already in this quality incentive program as a private facility. The remaining 9, 3 had initially expressed an interest in partnering with UMC. They were Regent Care Center of El Paso, Mountain Villa Nursing Center, and the Monta Vista at Coronado. In terms of the 3 facilities, currently right now, Regent Care Center of El Paso is interested in participating, and we've already started the process of what's called a change of ownership, documentation that needs to be filed with Health and Human Services Commission. Of all the 3 facilities, of the 3, we did tour all 3 facilities. The second one, Mountain Villa Nursing Center, this may be an option for the future, but because of the short time frame right now between from when we visited to the time that we need to get information over to Health and Human Services, they may be interested next year. The other one, Mountain Vista, the Monta Vista at Coronado, upon further discussions with them, they did not seem to be interested in this program. So currently where we are was that the next steps is that we are working with our consultant between now and April the 1st. There are 3 documents that need to be filed with Health and Human Services by Friday, February 14th of the intent of the hospital district to enter into this Medicaid QUIP program. And between now and over the next 45 days, we will be going through the details. There will be like 3 documents called a management agreement between the district and the nursing facility manager, a sublease agreement, and then also what's known as an operator's representative agreement. So right now, even though that we will send information over to Health and Human Services Commission, this is only for our intent. If there's any red flags that do come up between now and the next 45 days, we do have the right to pull out of this, this process. So that's where we are with this Medicaid QUIP program. There are certain language in terms of action that we're requesting for the board to authorize. Was it Jacob, our CEO?
Are there any questions specifically to this program? So the motion that we would be looking for is to approve and authorize the president and CEO to execute a change of ownership application for Regent Care Center of El Paso under the Quality Incentive Payment Program.
Can we get a motion to that extent?
So moved.
Second.
Ms. Olguin?
Yes.
Mr. Volk?
Yes.
Mr. DeGroat?
Yes.
Ms. Martinez?
Yes.
Thank you. The motion is approved. This does conclude our regular agenda. The time is 3:55 p.m. We will now prepare to go into executive session. Okay, please note, we are now back in open session. The time is 4:29 p.m. We'll move to agenda item number 23. Based on the discussion during executive session on the item to take appropriate action on the employment agreement of the President and Chief Executive Officer, the motion is to approve and authorize the Chair of the Board of Managers to execute the First Amendment to the employment agreement, the First Amendment to Deferred Incentive Compensation Agreement, and the 2020 Deferred Incentive Compensation Agreement as presented by legal counsel. May I have a motion to approve as presented by counsel?
So moved.
And a second?
Second.
Ms. Olguin?
Yes.
Mr. Volk?
Yes.
Mr. DeGroat?
Yes.
Ms. Martinez?
Yes.
Thank you. The agenda item is approved. We now move on to, well, may we have a motion to adjourn?
So move.
Second?
Second.
Okay.
you all.
Board of Managers meeting is officially adjourned. The time is 4:30 PM. Thank you.